want you to contrast our last two cases where patients had facial weakness, one with lower facial weakness only, as well as arm weakness, and a patient with upper and lower facial weakness with this final stroke case. 77-year-old male presents to the emergency department for slurred speech. He noticed the symptoms after waking up when he could not drink his coffee. When it did not resolve after 6 hours, he came to the emergency department. The patient is awake and alert. He's able to appropriately answer questions, though speech is slurred. On examination, there is weakness of the right upper and lower face. When asked to look to the right, neither eye moves. Eye movements in all the directions are normal, as is the remainder of the examination. Patient's blood pressure is 126/82, pulse of 65. He is not on an anticoagulant therapy. He has a normal PT-INR. Blood glucose is 98. A non-contrast head CT is interpreted as normal. Key things on this as you're looking back at the case presentation. This patient, like the last one, has upper and lower motor neuron, upper and lower facial weakness. He is not aphasic. There is slurred speech, probably from the facial weakness. The one major finding on this case is when you ask the patient to look right, the side of the face that's weak, neither eye moves. Ask the patient to look left, look up, look down, there's no issue. Ask the patient to look right, there is no eye movement. Neither eye moves. Neither the right nor the left eye will move to the right. For this case, would you give the patient tissue plasminogen activator or TPA, intravenous heparin, aspirin, low-dose oral prednisone, or high-dose intravenous methylprednisolone? The best answer, and the diagnosis I'm going for, is aspirin. This patient has a brainstem stroke. And there are those few subtle or not so subtle differences that help give away this case. This patient has evidence of a seventh nerve palsy, but also sixth nerve palsy. Sixth cranial nerve turns your eye to the side, but it also dictates the contralateral eye turning. Your right and left eye turn together, and that runs through the sixth nerve complex. TPA is not indicated. Though the patient's had a stroke, he's well out of the window. In the case, it says that symptoms started at least 6 hours ago, which is why he decided to come in, so he's beyond the 3-hour window. Heparin's not indicated for any form of stroke or other neurologic disorder, essentially. Prednisone would be for Bell's palsy, which he does not have, and methylprednisolone would be indicated for an inflammatory lesion, which he does not have. Well, I do not think and would not expect you to have a detailed understanding of neuroanatomy. This is one piece of neuroanatomy I think is really worth knowing. The sixth cranial nerve is in the midline of the brainstem and comes straight out. The seventh cranial nerve wraps around it. If there is a stroke syndrome, it will typically affect both. So the patient will have right facial weakness, upper and lower, and inability to look to the right. Why do I like that as a neurologist? Why do I like this kind of test question? Because it asks you to differentiate a very common and relatively benign condition like Bell's palsy, patient has exclusively facial weakness, from a patient with a much more ominous clinical presentation of a brainstem stroke, where there is damage to a deep structure in the brainstem affecting the seventh and sixth nerve. It is more than a simple Bell's palsy. Why I like it is a very simple exam finding, the ability to turn the eyes side to side, helps differentiate a benign condition or Bell's palsy from a much more serious condition in a stroke. So I can give you the same question stem, the same answer options, and I can really change what I do. For me personally, in clinic, when I'm in the emergency room, any patient presenting with upper and lower facial weakness where I think there is Bell's palsy, this is the most important exam finding that I look for. Can your eyes turn to the same direction of the facial weakness? Yes, no. If the answer is yes, it's probably Bell's palsy. If the answer is your eyes don't turn, I'm much more concerned for brainstem stroke, and I'm going to be much more aggressive in my evaluation. Well, I think this would be a little bit of a harder question. I also think it's a very fair question, differentiating a really common, simple disorder from a much more serious one. All right. So again, what's the key finding here? It's that relationship of the sixth and seventh nerve, and the fact that both will be involved in a brainstem stroke, and only the seventh nerve in Bell's palsy.